Okay, go back to the PowerPoint. Now we're going to talk about positive feedback. The stimulus here is enhanced or continue to expand, and the response rapidly completes a critical process. So here the change is stimulated. So what kind of changes are we talking about? Clotting. So if you get a break in a blood vessel wall or you get a cut, chemicals are released, clotting begins. The positive feedback loop accelerates clotting, and you plug the vessel and you stop bleeding. If the break in the blood vessel is too big, you bleed, lose all your blood, and you die. So this is positive feedback. If you don't have homeostasis, you can have failure of homeostasis. You'll get symptoms, and as we said, you'll pass away. So physiological systems work together to maintain a stable environment, stable temperature, stable ionic concentration, stable blood sugar, and so on. Everything's working together to maintain your uh, various concentrations of sugar, ions, and to maintain your temperature, your pH, and so on. Okay, what's anatomical position? What's it look like? You know what supine means in prone? Anatomical position looks like this. So part of your work will be able to do the first assignment and to review and learn all of these terms. So we expect you to know the technical terms: nasal, otic, thoracic, mammary, umbilical, pelvic, manual, and so on. We'll have no word banks. Your job will be to memorize all these terms, like antecubitus for the front of the elbow, brachial for arm, axillary armpit, mental chin, oral mouth, cephalic is your head, which contains the cranium and the face. So your job is to learn all of these anatomical terms. This is anatomical position with feet together, palms shown, the palms shown to the observer. This is the right side, this is the left side. So we look at the rear, and you should know the shoulder is the acromial. That's part of the scapula. The olecranon is the elbow. Back of the knee is popliteus. Popliteus. I don't know if I'm saying that right. I never can say that right. So you should know these terms also. So what are anatomical regions? There's four quadrants. Draw a line from your sternum to your belly button, and then draw a horizontal line through your belly button, and these are the four quadrants. So when a surgeon is recording a surgery and where he made an incision, if he makes it in the right upper quadrant, uh, on the lateral part of your stomach or your abdominal region, these terms are used to describe disease conditions or surgeries and so on. If we go to regions, epigastric is above the stomach, umbilical region is on top of the umbilicus, hypogastric is part of the below the stomach. Right hypochondriac is the ribs are underneath, right and left. Lumbar region is the lumbar region of the spinal cord, so you have a right lumbar region and a left lumbar region. You have a right inguinal region and a left inguinal. You have an inguinal canal where blood vessels and nerves, so on, go to the testes in the male. So know these various region names. If you look at the map of the regions, you can see that here's the stomach and the epigastric, here's the large intestines, here's the abdominal cavity, here's the pelvic cavity. Together, that's the abdominal pelvic cavity. So make sure you have an idea where the liver is, the stomach, the spleen, the large intestine, the small intestine, and so on. So what about directional terms? Let's see what each of these means. Okay, so anatomical position. Lateral is the side, medial is the middle, proximal is closest to the medial area, distal is far away from the medial area, and it refers to the position of the limbs. If you look at a side view, you can have the back, dorsal or posterior, the stomach, ventral or anterior, toward the cranium, toward the rear. Okay, what about planes and sections? Transverse plane, frontal plane, sagittal plane. So this is how an organism can be sectioned and cut through various planes to allow us to examine, MRI, for instance, or a CAT scan will help the surgeon see, for instance, whether you have fluid on your heart, whether you have fluid in your lungs, whether your lungs are damaged from COVID, and so on. So here's a frontal plane. This right here divides your body in an anterior and posterior segment. Sagittal plane divides your body into right and left. Transverse divides you into a superior portion and anterior portion. So you should know the meaning of sagittal, frontal, and transverse. So what are the body cavities? Organs are protected, organs grow and move, and the ventral body cavity is going to surround respiratory, cardiovascular, digestive, urinary, and reproductive. The diaphragm divides the ventral cavity into thoracic and abdominal. So the lungs and the hearts are in the thoracic cavity, the stomach, pelvic area, and the membrane surrounding the entire abdominal pelvic cavity with the thoracic. Okay. So this tells you what anatomical position is. We know that already. Okay, again, here's our back, our front, the pleural cavity and the pericardial cavity and the thoracic cavity. And the abdominal pelvic cavity is separated from the thoracic by the diaphragm. The peritoneal cavity is the membrane that surrounds all the organs in your abdominal and pelvic cavity. Procedures. Just be familiar with these terms. That's an X-ray. That's an X-ray of your stomach and so on. You can do a transverse section, and the machines of today will scan your entire body and allow the medical personnel to go through the entire cross sections of your body. Let's stop there. Go back to here. Stop recording. Stop